So hello guys, in this lecture we are going to talk about the route of administration. So how we take the different medicine. So there are few ways through which we can take the medicine or drugs. So we can classify this the route of administration into three main types. The first one is the enteral, right? The second one is parenteral, and the third one is a topical. This is the basic and the simple classification. The enteral means we take the medicine through by mouth, right? And from the mouth this drug will go into GIT, right, through the gut. So by mouth taking the medicine or those drugs which go to the gut, right? So this is known as enteral administration. For example, we take the different kind of tablets, right? So this will go into the stomach, and from the stomach it will go into the duodenum, and then the small GI, and then the large bowel, right? So from there it will absorb into our circulation, portal circulation, and from the portal circulation it will go into the systemic circulation. And then the parenteral. So the parenteral is basically divided into first of all, what is parenteral? It means that those drug which doesn't go into the GI tree, which doesn't go there, we take it directly into the systemic circulation. So those drug which we administer directly into the systemic circulation is known as parenteral, right? And the topical drugs, we use it just over the skin, right? So the basically most important are these two one, and most commonly we use these. So the enteral is further classified into the sublingual. So under the tongue we put some drugs, and this will go into the GI, right? And for example, nitroglycerin, these are the drugs used for the acute MI. And oral, right, we use through the oral direct. And the third one is per rectal, through the rectum. Sometimes we put there some medicine, and these medicine will go will be absorbed into the systemic circulation from the GI tract. Parenteral we divide basically into the intradermal, right, subcutaneous, and intramuscular, and intravenous, and intra-arterial, and intra-articular, and subdural, and nasal, and oral inhalation. But this is oral inhalation. Inhaled medicine doesn't go to the GI, doesn't go there, it directly go into the systemic circulation. For example, anesthesia, right, we give the patient anesthesia, some kind of anesthesia, oral anesthesia, in the form of inhalation. This will go directly into the lungs, right, and from there it will be absorbed into the circulation. Some medicine we are using oral or nasal inhalation, for example for the asthma inhaler, right? The most common and the most safe medicine we use through the enteral circulation, through the oral administration. This is the most common and safe and convenient, right? And the next one, the fastest is the inhalation, oral inhalation or nasal inhalation. These are the fastest way through these drugs will reach into the systemic circulation, right? In the intravascular or the intravenous, the intravenous is basically directly into the vein, and the bioavailability of the IV will be 100% because we are putting all amount of the drug direct into the systemic circulation, right? The intramuscular we put inject into the muscles, and from the muscle it will absorb into the circulation. The same way the subcutaneous also into the fats, and from there it will enter into the systemic circulation. So this is all about the route of administration.